Welcome to this edition of the Designs for Health audio science article.
Berberine may be best known for helping to support normal blood glucose and lipid levels. However, emerging research suggests this yellow alkaloid compound extracted from certain herbs, including Berberis aristata, may also benefit several aspects of musculoskeletal health. According to the World Health Organization, musculoskeletal conditions are the leading contributor to disability worldwide. Although there are more than 150 musculoskeletal problems that may afflict people, some of the most common issues are arthritis and fractures due to fragile bones. Fortunately, we can manage many of the risk factors for these musculoskeletal challenges, including inadequate physical activity, obesity, smoking, and poor nutrition. In addition, berberine may help promote a healthy inflammatory response and support bone and joint health. Bone fractures are a common result of osteoporosis. This disease is especially a concern for women because they tend to have smaller, thinner bones than men. Although estrogen supports bone health in younger women, levels of this bone protective hormone plummet at menopause. When estrogen levels decline, the production of pro-inflammatory cytokines increase, leading to increased bone resorption. Studies suggest berberine could impact various signaling pathways involved in musculoskeletal health and may help prevent bone loss. More specifically, this research includes animal, human, and cell culture studies. Bone protective properties of berberine have been consistently shown in animal models of osteoporosis that were designed to simulate menopause, aging, or medication side effects. In these studies, berberine inhibited bone resorption and promoted bone mineral density. Two small 14-week studies of postmenopausal women tested the benefits of berberine as part of a supplement taken twice daily, which contained 100 milligrams of berberine, 500 IUs of vitamin D3, 500 micrograms of vitamin K1, 200 milligrams of modified hop extract. Overall, these studies found that berberine formula improved bone formation compared to placebo, as assessed by multiple markers of bone remodeling. In vitro studies suggest a berberine derivative can promote osteoblast differentiation, a necessary step in bone formation. Berberine may also inhibit a series of signaling pathways that lead to bone resorption. Joint health can be impaired by osteoarthritis, rheumatoid arthritis, and gout. Osteoarthritis is the most common of these conditions, which erodes the protective cartilage on the ends of bones. The risk of osteoarthritis is increased by several factors, including aging, joint injury, overuse, obesity, weak muscles, genetics, and the female sex. In contrast, rheumatoid arthritis is an autoimmune condition in which the immune system attacks the synovium that lines the joints. This results in chronic inflammation and pain that can worsen with time. Orally administered berberine hydrochloride has been tested in animal models of autoimmune arthritis. After rheumatoid arthritis was induced in rats, they were given 200 milligrams per kilogram of berberine hydrochloride for 15 days. This attenuated the disease progression and reduced the disease severity by approximately 50%. It also decreased the levels of several serum pro-inflammatory cytokines. In contrast, the effect of orally administered berberine in osteoarthritis has not been investigated. Rather, the compound has only been tested by injection into animals or in cell studies. This research suggests berberine may help regulate articular cartilage synthesis and breakdown in osteoarthritis. A preliminary cell study has also been done to explore the potential for berberine to help against gout. This type of arthritis can cause episodes of unbearable pain due to the body's inflammatory response to deposits of uric acid crystals in joints. When scientists exposed human cells to berberine, it alleviated the inflammation triggered by uric acid crystals. Scientists are also investigating the potential role of berberine in preventing osteosarcoma, the most common adolescent bone cancer. Osteosarcoma usually starts in osteoblasts. Cell studies suggest that berberine has a high therapeutic potential against human osteosarcoma cells without affecting the proliferation, differentiation, and function of normal osteoblast cells. More specifically, research has shown that berberine significantly inhibited proliferation and induced apoptosis of certain human osteosarcoma cell lines. Scientists have hypothesized that this inhibitory effect may be due in part to berberine's ability to activate the p53 protein, which can induce cell cycle arrest. However, berberine hasn't been tested in osteosarcoma in vivo, therefore its clinical potential in this area is uncertain. Given the prevalence of arthritis, osteoporosis, and other musculoskeletal concerns, it's essential to continue exploring potential complementary health approaches such as berberine.
Thanks for listening. For more excellent educational content, be sure to visit designsforhealth.com.